Today we will talk about general anesthesia. It's important to know in surgery because always when we do some kind of operations we need anesthesia for patient, yeah. And for example, when we do a local operation, we need do a one type of anesthesia for patients. But when we talk about big operations, we need to talk about another type of operation, and we need working with our groups of doctors, yeah, where we include anesthesiologist, surgeon, and other who will help people to do an operation. You see in this picture what types of anesthesia we have. It's a local anesthesia. When we talk about, for example, we do a drainage of abscess, yeah, we do a local anesthesia in place where we do a surgery, yeah. Regional anesthesia, it's types of anesthesia where we do anesthesia of nerves what include a big zone of neuroreceptive system. In general anesthesia, when we talk about all organism, yeah, and we need to some big manipulation for do it. I will explain all of this type of anesthesia. I say that local anesthesia it's a blockade of nociceptive impulse along the surgical intervention. Regional anesthesia, it's blocked nociceptive impulses in the area of innervation of a particular nerve or nerve plexus in the surgical intervention in surgical surgical field. There we talk about central blockade. When we talk about regional anesthesia, we talk about central blockade, and we can do it to spinal, to the peripheral conductor, to intraosseous and intravenous. It's all include to the regional anesthesia. And the last one is general anesthesia. In temporary artificially induced condition in which there are not or reduced response to surgery and other polyceptive stimulus. There you see a big classification of the anesthesia, and I don't will explain it now. We will do in next topic, but you need to remember about this big classification. Okay, now we will talk about components of anesthesia. You see that it is 5 components, yeah? You need to know hypnotic component, analgesia component, neurovegetative block, total neoplegia, and the rest. Let's talk about all of these types. Hypnotic component. Its main task is to eliminate negative emotions and unpleasant experience before the operation and turn off the patient's consciousness during its execution, which is achieved by using pharmacological drugs, mainly tranquilizers and general anesthetics. Analgesia. There we're using analgetics, yeah, and opioids, non-steroid, anti-inflammatory disease drugs, and non-opioid drugs. This condition in which the body's reactions to pain, irritation are prevented or eliminated. There is a distinction between peripheral analgesia, in which insensitivity to pain is a consequence of tuning of reception and conduction excitation along the axons of the nocisensory fiber system. These axons conduct impulses for pain. Peripheral analgesia occurs when local anesthetics are administered intra-tissue. It is associated with the analgesic effect of local infiltration, conduction, epidural, and spinal anesthesia. Central analgesia occurs in the case of suppression of the activity of the central formations of the nervous systems involved in the conduct, modulation, and integration of pain. Central analgesia develops as a special condition after the introduction of large doses of narcotic analgetics. For example, morphine, fentanyl, and others. Some general anesthetics, turning off consciousness, give a general analgesic effect. Neurovegetative block. Prevention of excessive neuroendocrine and vegetative reactions to a complex of stressful operation factors. First operation factor, it's pain. Second one, blood loss. The next, redistribution of blood mass, vascular spasm, decrease in body temperature, and others. The main means of prevention excessive pathological reactions to this stimuli, provided the deficit of BCC and gas exchange disorders are eliminated. To achieve neurovegetative blockade, central and peripheral choline and adrenalytics, ganglion blockers, and membrane stabilizers we can use. Total myoplegia. This component eliminates muscle activity, which is a component of effector reactions to surgical trauma, provides muscles relaxation in the operation area, immobilization of the patient, and creates convenient conditions for the surgeon to work. This is achieved at different levels: terminal block, regional anesthesia, deep anesthesia. Currently, the most widely used muscles relaxants and the muscles relaxants that block conduction in the neuromuscular synapse. And when we talk about the rest components, there we will talk about maintain adequate gas exchange, maintenance of adequate blood circulation, and regulation of metabolic process. When we talk about maintain adequate gas exchange, basic and operational pathology, immobilization, physiologically unfavorable operation position, and other harmful factors that accompany surgery, as well as deep in anesthesia, muscle relaxants disrupt gas exchange. These disorders may have different genesis. There we will talk about hyperventilation, airway obstruction, alveolar capillary permeability disorders. Prevention and elimination of these disorders requires a complex of therapy. When we talk about maintenance of adequate blood circulation, this component is a system of measures aimed primarily at maintaining central and peripheral hemodynamics by maintaining the proper volume of the uh, volume of volume of circulation blood, and total peripheral resistance. The most important are preventive measures. Prevention of excessive vasodilatation and vascular spasm, hypovolemia, heart muscle depression. For this purpose, use an arsenal of pharmacological agents, cardiotonic, vasopressors, ganglion and adrenoblockators, and other drugs, as well as special methods for maintaining circulation homeostasis, uh, hemodilution, blood replacement, contrapulsation, controlled hypotension, and other. The proper level of analgesia and neurovegetative blockade, which prevents vasospasm and circulatory centralization syndrome. And the last one, regulation of metabolic process. This is the most complex and versatile component of anesthesia. The components listed above play an important role in prevention change in the internal environment under the influence of surgery, trauma, serious disease, and intoxication. Most often, it is necessary to correct the uh, metabolic processes, water electrolyte balance, and manage protein and carbohydrate metabolism, and acid basic balance. This is achieved by providing adequate energy requirements of the body and meeting the needs for carbohydrates, fats, and proteins, water, electrolytes, and vitamins, replacing hormones, prevention violation of thermoregulation, and artificially reducing the body's need for oxygen. Today, it's a general, a basic knowledge, what you need to know when we talk about anesthesia. It's just one part of many lections about this topic. And of course, we have I have some question for you. It's a disclaimer. And now some question for you. First question, what you think we see in the leg? What's the disease? Yes, what is this? The next one, what's the tactic of our treatment we will do with this patient? What is this? Third one, first, right, tap the types of mechanical antisepsis. Remember, it's first topic. And the last one, do a gradation of burns. Okay, thank you very much for your attention. Bye bye.